constituents to go as well.
Thank you. I now call for the official opposition, Preet Kaur Gill.
Thank you, Sir Mark, and it's a pleasure to serve under your chairship. Let me congratulate the member for Wirral West for securing this debate. I know she's a fierce campaigner to bring down NHS waiting lists and for an NHS that remains true to the principles it was founded on, a service that is there for everyone when they need it, free at the point of use. I also want to thank my honourable friend, the Right Honourable friend, the member for Hayes and Harlington. He made a powerful speech on how eye care is often a neglected topic. So Mark, the RNIB estimates that there are more than 2 million people living with sight loss in the United Kingdom. Shockingly, at least half of that sight loss might be avoidable. Findings from the recent workforce census of the Royal College of Ophthalmologists found that 63% of eye units estimate that it will take at least a year to clear their backlogs, and a quarter estimate that it will take over 3 years. And across our country, the demand for ophthalmology services has risen rapidly, and it is set to increase again by 40% over the next 20 years. And the current estimated economic cost of sight loss is around £25.2 billion a year. That is surely too big a price not to act. The current government has treated eye care as an afterthought. Today in England, there are 619,000 people on a waiting list for a hospital eye appointment and 250 people starting to lose their sight every day. Yet, unlike every other UK nation, this government has no strategy for eye health in England. The next Labour government will take eye health seriously. We will crack down on the tax dodgers and use that money to bring down waiting lists. And we will train a new generation of doctors, nurses and midwives to treat patients on time, doubling medical school places to ensure that we have the workforce that we need, including across ophthalmology. And we will reform the system too, so that everyone can access the right care when and where they need it. Moving more care to the community will help to support those suffering from sight loss, focusing on the provision of non-clinical community support to complement the work of community optometrists, ophthalmologists in hospitals and rehab offices. It is why the next Labour government would seek to negotiate a deal with high street opticians to deliver NHS outpatient appointments for eye conditions like glaucoma. There are currently 6,000 high street opticians in England equipped with specialist staff and kit that can get patients seen faster. We will put them to work to beat the backlog, free up hospital specialists to treat the patients in serious need, all at greater convenience to patients. As these are routine appointments, it will be less expensive to the taxpayer for them to be delivered on the high street than in hospital. And we know that delivering eye care in the community works. There was a study from 2014 which compared the impact of the introduction of minor eye care services in Lewisham and Lambeth on ophthalmology hospital departments. Lewisham GP referrals to hospital ophthalmology decreased by 75% and by 30% in Lambeth, while costs in areas that didn't have a minor eye care service increased, but cost in Lewisham and Lambeth decreased by 14%. And there was a separate data set from Hereford in 2022, which found that 92% of referrals to eye casualty by GPs could have been seen by an optometrist via the minor eye care services, but 83% of self-referrals could have been seen by MECs too. Perhaps the Minister could say today whether he backs Labour's plan to try and strike a deal for high street opticians to deliver additional clinical services, and has he made an estimate of how many people on hospital waiting lists now are waiting to be seen for issues that could have easily been seen in community optometric services. And according to a report published last year, more than 550 patients have suffered sight loss since 2019 due to NHS delays. That is absolutely tragic. It's not just patients who stand to benefit from Labour's plans, GPs do as well. From the removal of low-value, time-consuming paperwork that could be dealt with in opticians by optometrists themselves. Patients can already go direct to sexual health clinics as well as to physiotherapists in some parts of the country without seeing a GP. And in Greater Manchester, where lung cancer is the biggest killer of people under the age of 75, patients with risk factors can now get walk-in chest x-rays. Opticians who spot a problem shouldn't have to send patients back to their GP for referral to an eye specialist instead of referring them directly. So why isn't this the case everywhere? Labour's plans will see best practice adopted everywhere to allow opticians to refer patients to eye specialists themselves, meaning patients can be seen faster and GPs can get on with more important, meaningful work. We know how important eye care services are to our communities. We know that vision loss in older people has been proven to affect their physical, mental health and increase the speed of cognitive decline. And we know that sight loss can be symptoms of serious disease. So the government must set out a plan for these services with a mix of strengthened community-based care and prevention policies. It is right that we address the gaps in care coordination that disproportionately affect those with the greatest need, to give everyone the best opportunities to access education, employment and to live well in older age. Let's give everyone a right to sight. Thank you.